Hemophilia is a genetic disorder that impairs a patient's blood clotting abilities. It is also known as the royal disease because of its prominence within European royalty. Mode of inheritance. Hemophilia is an X-linked recessive disorder. It is caused by a recessive gene in the X chromosome. Consequently, only males typically suffer from hemophilia because the Y chromosome is recessive and doesn't affect the phenotype in terms of the disease. It is rare for a female to have two recessive hemophilic genes and thus show symptoms of hemophilia. However, it is possible for a female to have only one recessive gene and be an asymptomatic carrier. Possible allele combinations for hemophilia. Here is a Punnett square that shows a cross between a healthy male and a carrier female. As you can see, there are three possible alleles: X capital H or dominant, healthy, X lowercase h or recessive, hemophilic, and Y, the Y chromosome, which is recessive and doesn't affect the phenotype. Possible allele pairs for males are healthy or hemophilic. Possible allele pairs for females are healthy, carrier, and hemophilic. The last case is very rare and almost non-existent. As you can see from the Punnett square, a cross between a healthy male and a carrier female will result in a healthy offspring 50% of the time, a carrier girl 25% of the time, and a hemophilic boy 25% of the time. Here is a family tree that shows the history of hemophilia in European royalty. As you can see, the hemophilic gene started in Queen Victoria of England, who received the gene as a result of a mutation. She gave her gene to her offspring, and since then hemophilia cursed the family of the European royalty. How hemophilia occurs. Hemophilia is responsible for causing a deficiency in the production of clotting factor. Clotting factor is a protein that helps platelets in the blood to bind together and thus causes the blood to clot. Blood clotting is necessary for blocking cuts and breaks at sites of injury. Lower clotting factor levels in blood means reduced healings of cuts in blood vessel walls. Types of hemophilia. There are two types of hemophilia. Hemophilia A is caused by lack of clotting factor 8, and this is the more common of the two types. 8 to 9 out of every 10 cases of hemophilia are hemophilia A. Hemophilia B is caused by a lack of clotting factor 9, and it is the less common of the two types. Only 1 or 2 out of every 10 cases of hemophilia are hemophilia B. These are X-ray tertiary structures of each clotting factor 8 and clotting factor 9. They are responsible for helping the blood clot. Symptoms of hemophilia include excessive bleeding, excessive bruising, easy and prolonged bleeding, internal bleeding, especially in the joints, also in adjacent muscles and the gastrointestinal tract, prolonged nose bleeding, and vomiting blood. Risks of hemophilia include deep prolonged internal bleeding, loss of vision from bleeding in the eye, chronic anemia from blood loss, neurological or psychiatric problems caused by buildup of blood, permanent disability from unstopped internal bleeding, and death when large amounts of blood are lost or internal bleeding occurs in critical areas such as the brain. Statistics of hemophilia. In the U.S., about 20,000 people, or approximately 1 in every 13,600 people, have hemophilia. Each year, about 400 babies are born annually with hemophilia, approximately 1 in every 680,000. Almost all hemophilic patients are male. Hemophilia A is 5 times more common than hemophilia B, and it accounts for more than 80% of all cases of hemophilia. Treating hemophilia. Hemophilia unfortunately cannot be cured. However, it can be treated with regular infusions of the deficient or missing clotting factor, whether it be clotting factor 8 or clotting factor 9. Clotting factor can be isolated from human blood, another human being's blood, or recombinants, or a combination of both. Recombinants are basically viruses that have been genetically programmed to produce proteins for human use. Hemophilic patients are recommended to perform specific exercises to strengthen the joints and adjacent muscles to prevent damaging bleeds. Detecting hemophilia. Severe hemophilia is usually diagnosed during the first year of life. However, mild hemophilic patients may not be diagnosed until adulthood. If hemophilia is suspected, the doctor will first inspect personal and family medical histories to check for previous cases of hemophilia, and second, take a blood test to determine the clotting capabilities of the blood and check the levels of certain clotting factors and see if any are missing or lacking. Thank you for listening to my presentation. This is the bibliography.